I'm indeed delighted to be here this morning to launch the Fiji and Apollo Health Forum, a joint project of the Fiji National University and the Ministry of Health and Medical Services, the Fiji Medical Association and Apollo Hospitals of India. Ladies and gentlemen, as its name suggests, this gathering brings together a number of experts from Fiji and from India to effectively discuss ways in which we can contribute and improve the health and well-being of all Fijians. This is the second time for this highly skilled engagement between a major health provider from India, the Apollo Hospital Group, and the Fijian health sector. Ladies and gentlemen, this year we'll be seeing a major collaboration between the Fijian public and private sector. The Fijian Medical Association has come on board together with the Ministry of Health and Medical Services and the Fiji National University. The FMA is Fiji's and the region's leading medical professional organization, with about 320 odd members from the public, private sectors and academia. Ladies and gentlemen, the Apollo Group is a leading health provider in India, as you would all know, touching the lives of approximately 1 billion people, and hence a crucial player in the industry with an exceptional level of skill and experience. Therefore, this forum, ladies and gentlemen, will allow for sharing of these experiences and knowledge that will be beneficial for the Fijian practitioners. And furthermore, it is also an opportunity for the Indian practitioners to learn how things are done in a small island developing country. In addition, through this initiative, we are gaining access to some of the best medical minds from India in cardiac sciences, neurosciences, orthopedics, and critical care. The topics that will be discussed today are of great importance to the Fijian health fraternity, and therefore the topics will be further deliberated on during the Fiji Medical Association annual conference. Ladies and gentlemen, as enshrined in the Fijian Constitution, all Fijians have the right to access medical and health services, and therefore, to ensure the Fijians have access to affordable health services, the government has increased its investment in the health and medical sector. And today, the government is investing more than 4.5% towards the medical services. And moreover, today we have specialized skills in the public health care that was not available 10 years ago. And these include neurosurgery, cardiology, angiography and hospital, hemodialysis, nephrology, medical and pediatric oncology. I'm a lawyer, so sometimes it doesn't quite come out right, to name a few. We have visiting specialists coming to Fiji, especially in the public health system, who not only provide the specialized services, but also provide on-the-job training for local health professionals. Therefore, ladies and gentlemen, this partnership with the Apollo Hospital is of great importance, as it holds out a promise to deliver better health care outcomes for ordinary Fijians across a range of disciplines. Ladies and gentlemen, on behalf of the Fijian government, I'd like to sincerely thank our Indian counterparts and friends for their willingness to provide their expertise and engage with our very own health professionals. And we must admit that it is impossible to overstate the importance of partnerships as such for Fiji. Ladies and gentlemen, the ability to deliver proper standards on health care to meet the needs of ordinary people is a continuing challenge in even the most advanced countries. Developed countries like the United States, Britain and Australia are experiencing extreme pressure on their healthcare systems as people demand better care. Therefore, the challenges in a developing country like Fiji is even greater, where the gap between the demand for health services and our ability to supply them is often stretched to the limit. However, this does not mean that the government will not work towards providing the best services. Ladies and gentlemen, one of Fiji's biggest challenges, and is a challenge for every single citizen, is the burden on our health system of patients with non-communicable diseases, NCDs. And diseases such as heart diseases, hypertension and diabetes are now a bigger problem in countries like Fiji. And for this reason, we need a bigger effort to tackle NCDs, and this requires a fundamental change in the behavior of our people. Ladies and gentlemen, we are determined to achieve a steady improvement in the service delivery, and in the past 6 years, the Fiji First Government has created many employment opportunities for doctors and nurses in the country. A scholarship scheme for doctors wishing to advance their studies was also announced in the national budget last year. We're always seeking imaginative ways to overcome the problems we face and to think outside the box, to enable us to meet an acceptable standard of healthcare for a country of our size and means. Ultimately, this means developing more partnership and collaboration with organizations such as Apollo to help us leapfrog over the current hurdles, particularly in the delivery of tertiary healthcare. For this, we will require the strongest possible commitment from our health workers, whom we highly value for their dedication and skills. So, ladies and gentlemen, I wish you all well. With those viewers, I wish you all well for this afternoon. And once again, I thank the Apollo team for being here. Thank you very much.